This setup today is going to be for IUD insertions. Again, I have everything in the order that we will be giving it to the provider, such as speculum, iodine, hurricane, the dilator, sound, instruments, IUD. So before we do any of that, the provider will be doing a bimanual exam, and so you want to get your lubricant and give it to the provider. You want to make sure you don't touch the glove, but instead just drop it on there like that. After the bimanual exam, you will hand off the speculum to the provider, which is already pre-lubed. Again, you want to make sure it is sterile, but for the sake of the video, we just took it out of the package, so we didn't have to waste any more instruments. She will place in the speculum, and we will then hand her the betadine in a cup. This one was a thin prep, but we didn't, again, want to waste any more items, so we just reuse this. We hand that to the provider, and they will then swab the cervix and get it ready for the IUD. After that is done, we will then use a numbing spray called Hurricane. We will hand it to the provider, and that will then numb up the patient so that way they experience the least amount of pain during the IUD insertion. While that is numbing the cervix, the provider will actually come right over here and put on the sterile gloves. While the provider is putting on these sterile gloves, you want to take the sterile instruments, place them in here, and open it for the provider. After you place the sterile instruments on the tray in front of the provider, you will then hand the provider these sterile instruments. Again, you want to make sure that you do not touch these as they are sterile and going into the cervix and into the uterus. You want to open up these two ends, pull them apart, and let the provider grab it. After you've done that one, you want to go into the other package and do the same exact thing. Before the provider puts in the dilator and the sound, an instrument called the tenaculum, which looks like this, would essentially just be pinched onto the cervix to hold it into place. But because that's a faux cervix, we're not able to do that, but I do want to show you what the instrument looks like. All right, and the provider will then proceed to insert the dilator and the sound in preparation for the IUD. After the provider inserted the sterile instruments like the dilator and the sound, you will then get the IUD. You do not want to open it until the provider knows that they are ready for it and instructs you to get it for them. So you want to make sure it's on a level surface, and you will then peel it open, and the provider will then grab the instrument and insert it. After the provider grabs the IUD, she will then place it into the cervix. The provider will then go ahead and cut those strings after the IUD is inserted. And that is the end of the procedure. After the procedure, you want to make sure that you have these instruments for autoclaving. You do not want to keep the sound or the dilator or the IUD because those are disposable, obviously. So you want to make sure you just get these and autoclave them. Of course, you want to make sure that you check on your patient Make sure they're not feeling faint, dizzy, lightheaded, anything as such. If they are, you want to ask the provider what to do, whether we give pretzels, Gatorade, anything like that, so that way the patient walks out without falling on their face. Thank you, Annie. You were great. Everyone, thanks for watching the video.